It is estimated that 1 billion people around the world suffer from many different types of neurological disorders with devastating effects to their lives and the lives of their carers. In the case of neurodegenerative diseases such as Alzheimer's disease, Huntington's disease, and Parkinson's disease, one of the main challenges surrounding diagnosis and treatment is the delivery of drug to the brain due to the efficient protective mechanism that is the blood-brain barrier. Nanoparticles are very small molecules that may hold the answer to cross the blood-brain barrier without disrupting it. In this video, we talk about how nanoparticles can help diagnose and treat early-onset Alzheimer's disease, the most common form of dementia for patients under 65 years of age.
In this video, we will use the film Still Alice as our ambassador.
Even though familial and sporadic Alzheimer's disease have different etiology, they have similar pathophysiology. The pathological hallmark of Alzheimer's disease is the increased levels of amyloid beta and increased levels of hyperphosphorylated tau. These pathologies can initiate a series of events that causes widespread neuronal and synaptic loss. The small size of amyloid oligomers allows them to diffuse in between synapses and impairing neurotransmission. Amyloid peptides can also aggregate to form amyloid fibrils, which eventually lead to the formation of neuritic plaques. These plaques are known to be neurotoxic and impair the normal function of the cells, such as mitochondrial and lysosomal activity. Additionally, they initiate progressive inflammatory cascades that damage neurons and glia. Tau, on the other hand, is a microtubule assembly protein. In Alzheimer's disease, hyperphosphorylated tau accumulates intracellularly and forms neurofibrillary tangles, which are also toxic and impair the normal function of the cell. This abnormal accumulation of tau impairs axonal transport, damages synapses, and induces mitochondrial and lysosomal dysfunction that eventually lead to neurodegeneration. Altogether, these pathological events seem to target cholinergic neurons in the basal forebrain. Now, in a macroscopic level, we can observe atrophy, widening of the sulci, and enlargement of the ventricles. These changes are more pronounced in the frontal, temporal, and parietal lobes. Subcortical structures, the brainstem, and occipital lobes are spared. Alzheimer's disease pathology is firstly noticed in the entorhinal cortex and the hippocampus. However, in the later stages of the disease, it spreads throughout the brain.
The symptoms of Alzheimer's disease develop in 3 stages, from the preclinical to the severe stage. Starting with the preclinical stage, patients first experience memory loss. Then in the mild to moderate stage, patients experience poor judgment, mood changes, anxiety, difficulty with language, wandering, and problems recognizing other people, among other issues. At the severe stage, patients suffer from seizures, skin infections, loss of bladder and bowel control, among other things, and patients are completely dependent on others at this point.
Most cases are non-familial, and because it's usually atypical, there tends to be a delay in diagnosis. The risk factors associated with early-onset Alzheimer's disease are mutations of the genes presenilin-1, presenilin-2, and the amyloid precursor protein, though they can only explain 5 to 10% of cases. Early-onset Alzheimer's disease is the most common form of dementia in patients under 65 years of age, and it has similar clinical features as late-onset Alzheimer's disease. However, there are some differences that are worth noting that can be summarized as follows. Lower cardiovascular and cognitive fitness, increased consequence of traumatic brain injury, psychosocial issues such as loss of independence, grief, anxiety, and depression due to relatively preserved insight, better recognition memory and semantic memory scores compared to late-onset Alzheimer's disease patients, but worse attention, visuospatial skills, executive functions, and ideomotor praxis. Greater neocortical atrophy in parietal lobes and less atrophy in medial temporal lobes. Larger sulcal widths in temporoparietal cortex and preserved hippocampal volumes. Early-onset Alzheimer's disease comprises 4 to 6% of all Alzheimer's disease cases.
The promise for the early diagnosis of Alzheimer's disease is the current focus in developing nanoparticles for imaging and molecular detection biomarkers. Nanotechnology-based theranostics, where nanoparticles can be used in both Alzheimer's disease diagnosis but also therapy, offers a combination of highly sensitive molecular detections and effective drug targets, which can improve Alzheimer's disease therapy, consequently delaying the memory loss and increasing the life expectancy of the patient. Theranostic nanocarriers can be developed from a variety of organic and inorganic nanomaterials, like polymeric nanoparticles, nanocapsules, and many more. Highly potent signal transduction can be achieved with nanotechnology that may help in the early diagnosis of Alzheimer's disease. This potential application of nanotechnology in imaging and detection is primarily based on the physical, magnetic, optical, or electrical, chemical, and/or biological quality of smartly designed nanoparticles. Conventionally, the soluble biomarkers of Alzheimer's disease can be detected by two general approaches. The first is based on determining the entire tau protein or amyloid beta concentration in CSF or in plasma. In the second approach, only the suspected pathogenic biomarkers are targeted. For instance, phosphorylated tau protein, cleaved tau protein, or amyloid beta derived diffusible ligands.
Nanoparticles in neuroimaging. In 2009, an in vitro experiment was conducted by Scar and Margle. They used synthesis of fluorescent magnemite nanoparticles as imaging agents to highlight amyloid beta fibrils. They selectively marked amyloid beta fibrils with fluorescent magnetic gamma iron oxide colors, such as rhodamine, Congo red, and yellow. These are highlighted in the boxes A1, B2, and C1. There is a future aim for these to be used as contrast agents in MRI scans.
There are many protective mechanisms of the brain that prevents it from getting damaged, such as the skull and the cerebrospinal fluid. Another protective element of the brain is called the blood-brain barrier. The blood-brain barrier is composed of high-density cells and it restricts the flow of substances from the bloodstream to other parts of the body. This prevents harmful chemicals and bacteria from reaching the control center, but it also blocks roughly 95% of medicine from being delivered orally or intravenously. As a result, doctors who treat patients with neurological diseases will have to inject the drugs directly into the brain, which is an invasive process and involves drilling into the skull. Alzheimer's disease is complex. There are no drugs or interventions that can fully cure it. Current approaches focus on helping people maintain mental function, manage behavioral symptoms, and slow down the symptoms of the disease. Most medicines work best for people in the early or middle stages of Alzheimer's. For example, they can slow down some symptoms, such as memory loss, for a short period of time. There are two types of medication that has been approved by the US Food and Drug Administration to improve the symptoms of the disease. These are cholinesterase inhibitors and memantine. It is important to understand that none of these medications stop the disease itself. Some drugs curb the breakdown of a chemical in the brain called acetylcholine, which is important for memory and learning. They slow down the progression of the symptoms, but these will only work for about 50% of the people who consume them. The effects of the medications are limited and will last about 6 to 12 months. Common side effects are usually mild for these medications and include diarrhea, vomiting, nausea, fatigue, insomnia, loss of appetite, and weight loss.
Targeting the beta amyloid 142 peptide in all of its aggregation forms has been suggested for therapeutic and diagnostic purposes. Currently, the most sought-after strategies are nanomedicines, which are designed to interact with the blood-brain barrier cells at the molecular level. In the therapy of Alzheimer's disease, these nanomedicines exploit the existing physiological mechanisms of the blood-brain barrier for the transport of nanomedicines. Receptor and absorptive mediated transcytosis are the most important mechanisms that facilitate the transcellular transport of nanomedicines from the blood to the brain. Once the nanoparticles enter the brain, their differential binding to oligomers and monomers of beta amyloid can be exploited as a way to achieve specific inhibition. The most important properties of the nanoparticle formulations comprise of particle size and charge, core and surface properties, shape and flexibility, as well as multivalency and controlled synthesis, because they determine the in vivo distribution, targeting ability, and toxicity. Hence, these properties have a strong impact on drug loading capacity and release, and on the stability of nanoparticles. In vitro studies showed that the use of polymeric nanoparticles enhanced drug delivery to the brain with reduced oxidative stress, inflammation, and plaque load through the improved delivery of curamine for treating Alzheimer's disease.
A current development using nanoparticles in AD is one of extracorporeal cleansing. The diagram on the left displays the assembly of magnetite carrier nanoparticles, or mCNAs. These are pre-assembled for extracorporeal cleansing of amyloid beta. This compound can also be used for scavenging reactive oxygen species. Now focusing our attention to the diagram on the right, you'll see the radical application for the use of mCNAs in blood amyloid beta extracorporeal cleansing. This is done by Kim and colleagues in 2019. The mCNA-infused blood is bound to amyloid beta peptides. They are then removed from the blood via magnetic separation. The cleansed blood then returns back into the body. There are promising results displayed in the tables below. In the future, Scott and Margle suggest that it may be possible to expose the magnetized fibrils to a locally applied heat as an effective way of breaking up amyloid beta. Some concerning side effects of nanoparticles treating Alzheimer's disease can be cytotoxic. This is due to nanoparticle actions on the brain capillaries and endothelial cells. Also, there can be undesirable necrotic and apoptotic cell death due to unusual intracellular trafficking. Some individuals can be extremely sensitive to nanoparticles. This can trigger anaphylaxis due to the activation of the complement system in the immune system. Intracellular signaling interference can also occur. This impacts normal cellular regulatory functions of messenger RNA.
In summary, our research has concluded that current methods are not sufficient for the management of Alzheimer's. Although much work needs to be done, nanoparticles are being viewed as a viable option for the next step in Alzheimer's treatment, as well as other neurological diseases. Thank you for listening.